As the nation's top education officials push to get the schools back open this fall, many families in urban areas continue to face unresolved issues that can impact a child's education and growth. The Schott Foundation works with cities across the country in working to achieve social equality for all. Joining me now, Dr. John H. Jackson, President and CEO of the Schott Foundation for Public Education. Dr. Jackson, thank you for joining us today. I want to talk, this is a conversation we could have had in January, but because of COVID-19, perhaps some of these inequities in society have been pushed to the forefront. For instance, there are some parents who are able to work from home, continue to have health insurance, continue to be able to contribute to their child's college education. And then there are families who have lost their jobs or had hours drastically reduced due to COVID restrictions, who are now looking at, making sure they can get food on the table and making sure they have safe shelter. And here we are discussing, will schools all across the country open? So your thoughts on where COVID-19 has put us now and immediately, but also in a broader look at where we've been for decades now. Doctor?
Well, thank you for having me, Molly. First of all, we do have to start at the beginning. Unfortunately, our country's history started with brutal oppression against Native Americans, the period of brutal oppression in slavery. Then we moved to legal oppression through Jim Crow laws, redlining, segregation. And all of those policies and practices have been baked into the outcomes in cities across the country. So this week, the Schott Foundation released the Loving Cities Index report, which is essentially a measure of the degree to which cities have addressed their infrastructure and equity issues in order to be able to care for all of its citizens. Because the only way that we deal with hate and systems of oppression is with building systems of love. And so this index looks at cities across the country, cities like Miami that pre-COVID, the index indicated was only providing 50% of the supports needed for children and families to thrive. We had 50% of Black and brown families that were working full-time jobs but barely living above the minimum subsistence level, low access to affordable housing. And then, Molly, when we stack COVID on top of that, it leads to a situation that we have now where in 42 Florida hospitals, there are no more ICU beds. In Miami-Dade County, the public health system for Miami, the Jackson Health System has asked for 100 more nurses. So essentially, if we don't address these infrastructure and equity issues, we have cities across the country that are unable to care for its citizens. So there are serious infrastructure and equity issues.
Yeah, you spoke about the index, so I just want to pop up some of the stats that we sort of pulled from that index to give an idea for folks of some of the things that you found. For instance, Atlanta, 55% Black families, 69% Latino families make minimum salary to support their living. In Dallas, very few social workers in the schools. Detroit, 40% of Black renters, 50% Hispanic renters have access to affordable housing. Jackson, Mississippi, 28% of low-income residents have access to healthy foods. The interesting thing about this index is it doesn't just focus on, say, test scores, which are so often used to decide what schools are good and bad, but it also focuses on the families and their needs, on healthy food, on affordable housing, on public transportation. What does it mean when parents can afford those basic things for their kids versus when they can't?
Well, Molly, we know that parental income is the best predictor for student outcomes. And in many respects, parental income is a proxy for a host of those indicators that you just outlined: access to healthcare, access to transportation, healthy foods. So we have to be able to measure the degree to which cities are able to provide these infrastructure supports and do it in an equitable way if we care about all students having a fair and substantive opportunity to learn. In Mississippi, which just removed the vestiges of the Confederate flag, you mentioned the disparities that exist there. Now you stack COVID on top of that, and 5 of the state's largest hospitals no longer have ICU beds available. So it's a serious issue that we have to address. Now, I understand that we're at a point where we need to reopen our schools, and there are families that have to deal with the very stressful choice of, do I send my child to a school that isn't prepared or hasn't receive the resources yet to reopen, or do I keep my child at home and run the risk of potentially losing my job? So in order to address this, it's time for leadership. We need leadership. We need the Senate to pass the HEROES Act, which will provide an additional $500 billion for states and localities, of which $175 million should go to the K through 12 educational system. Because there's a study, Molly, that indicates that districts across the nation will need at least $1.8 million in additional resources just to make it possible to reopen the schools safely.